Hello, everyone. So this is Sharir, mentor for a long time. I'm tutoring currently, AMC exam, PLAB exam, and we have been also opening, USMLE exam. Uh, some of these three exams are top three and very popular. It takes me a lot of time to go through this exam. So I thought of, making a comment on these three big exam and some of the other prospects, what people think, when they're considering going to the abroads actually. Yeah. So because, day-to-day time, I get to deal with a lot of doctors, medical students, and guided so many, IMGs so far. So I have seen, how people made mistakes and some people choose one thing and the next time they're choosing another thing. So the in between, there's a huge time loss. Some people, because of the poor family decision, they cannot make good um, decisions. Some people has the bindings, they have to stay in country, and they took the decision much late. So if you are into these categories, probably this video is for you. Also, there's another group, they think of their children's future, which country is better in terms of everything, which country has good salary, which country has faster citizenship. So this particular things, we like to add here actually. All right, today it's a very interesting video. I hope so this will be one of the highest views videos in coming days. So don't hesitate to, like, share, and share it in your medical college platforms as well. All right, so that will be a small help for us to help others actually. So helping you, you can also help us as well actually. Or also, if you have any inquiries, please do ask in our YouTube, comment section. I'm very active also on that one. Now the question here is like, are you making any mistake, especially in terms of uh, choosing a country, like you can see US, Australia, UK, Dubai, Middle East, Canada, home country, a career for doctors, we are talking about actually. So let's find out the very first one actually, some helpful tips. The very first question actually, the best salary. All right, now this is an interesting question. The best salary actually, people, I mean, the world is, everything is related to money. Definitely, it's very, very important. Money is important. So probably the dignity comes second nowadays. Actually, there used to be a time actually, like doctors even don't have to think in that way. So for young generation and whichever the generation, even you see your professors, they're earning all the time. All right. So earning with a dignity, better word to say actually, but money is important. There is no doubt on that one. So in terms of that one, the highest salaries being paid. So high salaries being paid, Australia, it has been very popular in terms of the payment for the physicians among many of the countries. Other than that, USA is also very high salary has been paid. Now it depends on the different specialty. If you ask one specialist and another, his seniority, his works experience, how many years they have passed, how many years they have passed in their home country. Some people also migrate later, so they get little advancement or little benefit when they have home country experience, especially countries like Australia. If you see, if you countries like Dubai, if you see, if you have home country experience, you'll get more benefit because of that actually. And if you get higher level, even it goes applicable in case of even in UK as well. Like, are you planning to join FY2 or City 1? If you have experience, you can join the City 1 level. You can see some other our other videos, like what do you mean by FY2, City 1, these levels. We have the PLAB inquiry videos. Actually, we'll put it in the description. You can see that one. So every exam has its own thing. So you can see the relevant exam videos to know more details actually. Now, here's the thing, the salary matters the most. So I would say if we again see these big countries actually, so we would say Australia and USA has very high salary, whereas depends on your seniority. If you are a consultant and if you're going to countries like Dubai, you may also earn a lot at the same time. Canada, it is good salary, but getting the job is difficult for the doctors because of very less training positions actually. Okay, so hope you understand that actually. So the matching system is present. It is related to US and the Canada belt. So this matching system is a bit complex, and Canada has less people, so it means they need less doctors. So in relation to that one, it's high likely. And also a lot of people are already in the Canada. They have their own medical graduates too at the same time. So considering all thing, Canada is country something we always don't recommend to the doctors unless someone been to the already Canada and they don't have choice. Then there is an exam called MCCQE. That's the exam name actually. All right. So we were discussing about the salary. So some of the so I would say Australia, USA has the highest salary in terms of the UK. There's some benefit of working in UK, but salary wise, it's not the best country, certainly. Next helpful tip or helpful inquiry that is coming up is social security. Now, social security, when you compare to our countries, let's say I'm from Bangladesh, if we compare any of those countries which we have shown you earlier, is much better situation in these countries. Actually, social security is very high. You can send your kids very easily to the schools. You don't have to check. They can take their own school bus, their class 4, class 5. They can go to like the school by of their own by going to the school bus which comes just next door, so it's kind of like that. So social security, the public transport services, no harassments and the things, it is extremely low. Crime rates are extremely low actually. You may heard things in their newspaper too, but to be honest, compared to certain Asian, African countries, the crime rates are very low in Australia, USA, UK. But certainly, like some rare cases, things can happen. But it's still, these are very safe country to be honest. Actually, especially I would say in Australia, it is like livable country, and there is no like cross border. See a lot of uh, international crime things happen when you have a different country cross border things. Australia don't have any borders with anyone, so in a way that's good in terms of the security. Actually, it's like bit isolated from many of the places. So I think so Australia, New Zealand has good security, but in spite we saw there was a incidents in New Zealand actually. But it's still, still these are like very safe country to be honest. In terms of the USS, we know sometimes we heard about racism and things also sometimes in UK. Now see, racism is a thing, just up to you, it like, if you don't know how to talk to people, like, they might make fun of you out of you. It is also possible in your own country. So that doesn't mean like racism. Rather, I feel they came up with a smile. Actually, I've been through all these countries. So, they always come up with a smile actually, in their face, what's inside, they don't show it, but it's like at least they come up with a smile. If you're walking into the footpath, they will leave the road for you. So this is nice gesture, seeing your attitude and the thing. So you also have to be nice hearted equally. Like you are always in hurry, you don't show respect. So respect comes when you also show respect to others. Actually, keep that one in mind. Number three, important inquiry that is coming up, and my helpful tips, like, family living in abroad. Now, this is many people I say that, whenever you come to us asking, doctor, which country would be better for us, sometimes many time we ask one question: do you have any family member living? Like many of you have brother, sister, they're the first blood and living, and you can get some uh, benefit in that case, actually, in terms of they're living there, not in terms of citizenship always, but the initial establishment, they can show you, they can introduce you, they can help you with references. So this can be additional, like, and also coming to an abroad and doing courses and the things. So sometimes maybe quite expensive. Nowadays trends are changing, people also attending a lot online courses and the things, and they're passing from their home country. Like MC2 exam, Australian Medical Council 2 exam is online. You can take it from your home country. For US exam, they have recently made an update that they have changed that to CS and convert it into OET exam actually. So OET you can take from your own country. So these are some of the updates of some about some exams. So living abroad, if family is living there, that gives you added benefit in terms of the establishment. When you come for courses, that can be something beneficial for you actually. Now next coming is a very four important helpful point or inquiry based, that is quick establishment. Now UK I would say is sometimes more quicker in terms of the establishment, like finishing PLAB 1 PLAB 2 exam and getting into the country. If your parents are pushing you for your marriage, sometimes just making fun, pushing you for marriage, oh, you have to get married in 6 months. No, I mean, UK can be a good way, like, in a 1 year you can finish it, the exams, and in next 6 months, like in 1.5 year you can be in UK, to be honest actually, which might take a little bit more time in case of USA and Australia. Canada is even much more way difficult. All right, so these are some of the points you can consider, if you are in that kind of situation that you need a very quick establishment. Yeah, so see, those are dedicated, you can get job anywhere, no matter UK, USA, Australia, but it depends, like, if you're in too much rush or not. There's a word, slow steady wins the race actually. You can think like, even if you're going in Australia, USA, you can earn more money, but for that you probably have to invest a little bit more, because exams are a bit more expensive than UK, in Australia and USA. So but it will come as a return to you in much bigger prices actually. That's all I can say. All right, next coming is a number 5, like very like helpful, important tip and inquiry based. Like that is something citizenship. Often, commonly I got asked and think. First of all, I'm not an immigration lawyer, so my statement don't take it as a major statement. Actually, I can tell some few things from the experience and some knowledges which I gather like time to time from the websites and the thing. But any immigration lawyer, I mean, good immigration lawyer, there's like a lot of pseudo immigration lawyer, they pretend themselves as immigration lawyer, they are not actually. All right, so certain countries has good with citizenship. Number one, I would say Canada is very good with citizenship, but again the issue is the job actually. You're not getting the job easily, and it's quite difficult in Canada. I mean, even in my academy, there's so many people like they finished their Canadian exam, now they're preparing for UK or Australia based exam, because jobs are not available actually, and they have fully established, they have citizenship, but the job is not there. So if you go to Canada, maybe, and if you agreed, passion is most important. Of course, you should follow your passion. If you want to be working as a clinician, then that is okay, but Canada is not the best country in that case. So in that case, any research topic or any pathology, doctor's assistant, research assistant. So many other types of jobs available in all countries, including Canada. So if you can do some compromise, it's good living in Canada in that case. All right. In terms of the Australia, citizenship is also second faster, I would say. If you finish everything, like, Australian Medical Council exam 1, 2, and you work in Australia for 1 year, you can straight away apply for citizenship after your general registration. All right, so this is a plus point in Australia. In case of US, that might take a little bit more time. They have a lot of complicated things, like, but it depends on the sponsor. So you probably get that thing in 4 or 5 years. Same goes with the UK. Like USA, it depends, guys. There's certain sponsorship can give you the citizenship more early, the green card more early. Some may have, because of the family, green card earlier. They already have it, that so they don't have issue. In UK, it minimum takes 5 to 7 years to get the citizenship actually. All right. So as an NHS worker, minimum is 5 years. So maximum is like a 7 8 years it will take. All right. So in these cases, I would say Canada and Australia are the fastest, in terms of the getting the citizenship. Next coming is a number 6, very helpful tips coming up, and then one of the very common topic for discussion is total costing. Now that's a tough one to cover here. In generally, I would say, like, for Australian, like when I finished, like it was different. Now it's a little different. So in Australian Medical Council exam, like, I would say, uh, if I tell in it in lakhs, I would say you will understand some Asian doctors. So I would say for Australia, you need probably 10 to 12 lakh for the whole journey, exam 1, exam 2, courses. then going to Australia, living there for some time. So altogether 10 to 12 lakhs probably. In case of UK, you can do it in like 7-8 lakhs actually. PLAB 1, PLAB 2, then OAT, OAT exam. Then of course for PLAB, this OAT is sometimes difficult in the beginning for some people. So their total amount can increase even more actually. If you are attempting OAT like 2, 3, 4 times, then total costing would be higher in that case. Actually, if you're failing in any exam, your total costing can be higher. Guys, remember one thing, every exam is possible to pass in a single go. It is very, very important to remember actually. So total costing for Australia is 10 to 12 lakh, is total costing for PLAB is 7 to 8 lakh. Total costing for USMLE is somewhere in between, again 10 to 12 lakh if we compare up to step 3. But you can get establishment nowadays. There's a new update in USA that is only step 1 is step 2 CK, then go for OAT. Previously step 2 CS, which you have to go to the USA and go with some kind of clinical based exam. So now you don't have to do that. You can give USMLE step 1, step 2, and the OAT exam in that case. Okay, so then apply for matching. Now matching is a bit you know uh, waiting period actually. It's another game actually. I would say game, for the matching things actually, but they're trying to make it more relaxing. So you may see in coming future USA might be a little bit more make things easy for the doctors actually, because after COVID every countries need more doctors. Australia is already hiring a lot, UK is already doing it, and USA they are up to they, because one of the sign, they have cut down the step to CS, because US visa sometimes is an issue. When they give visa they give for 5 years often actually, so their visa sometimes an issue. There's a visa rejection rate is high, which we will talk in another segment. So that issue is now not much there, because you can give OAT and then clear it OAT and apply for the matching directly from your home country actually. Now next coming is important 7, that is the thing is actually like very helpful tip is actually education for children. Because see, for us there's a junior doctors medical student, they ask for there's another group of people, their ages are 40 or over, they also ask us actually which country would be better. Now one thing in USA, if you have passed your MBBS exam um, within 5 years, then USA is fine. Otherwise, we don't recommend the USA, because USA asks for explanation of everything in more strict way. So if you are under the 5 year, USA is not the best choice. For UK, you can try at any age, it's fine totally. Australia even more fine. Australia is rather more popular, especially if you have experience 2 to 3 year from home country, it's more popular in Australia actually. You can get, this is the only exam where you can get the job directly. The point is called limited registration Australia. You can type in Google limited registration EFRA, FEHRA Australia. People can get job just after part 1 exam, even if you have 2 to 3 years of experience. All right, so this is a very important point for Australia to remember actually. Next, number 8 point is coming is a visa rejection, which I was talking a little early, that that about visa rejection. Visa rejection rate is much more higher in USA than any other, probably for the doctors actually. There's a like thing called Big Five. I'm not sure you heard about that one. So here few visa tips for you. We'll make a separate video on that one. But please guys, do not especially WhatsApp me for visa things. I'm not visa expert. Okay, that way. I'm just telling, because I never got rejected with any visa. I've traveled many countries actually. So few basic things when you give paper, make sure while you are working, give the NOC properly, no objection, and show some money in your account actually. Okay, that a money which you are not moving much actually. If you have some saving actually, most importantly. So example like a $10,000, if you can show the saving or a little bit more than that, that's always better actually. Okay, just like now some might laugh in the comment section. We don't have 10,000. You can borrow from someone, maybe parents, and put there if you have the plan in next 3 4 months actually. Okay, so this is some of the tips actually. Visa rejection rate is, as I mentioned, is high in US compared to Australia or UK or even Canada. Now, Big Five, I was telling, if you have visited these countries like UK, USA, Australia, New Zealand, Canada, Big Six, and Switzerland. If you have visited all these countries, your visa for any big countries would be very easy. All right. So this is the thing. By the way, Singapore is also good country for Asians. If you go to Singapore, it also shows a good sign. Now, visa get rejected sometimes in some people who has never has a history of traveling to anywhere. There's a possibility that they thought you don't have any history of going out and going in to any country, so you might go in any big country and you never might go back. So the visa, the immigration, they think in that way. Actually, you are a doctor or not, it is not usually their concern. And doctors also do a lot of crimes. It's not like doctor doesn't mean they don't do crimes. It is not like that. They also do a lot of crimes everywhere. All right. So the thing is, like, this is how to think while submitting the NOC papers, the savings. Oh, income tax certificate, very very important. If you're giving paper of the spouse, give it correctly. If you're giving paper for the children, give it also in proper way. Actually, I mean, so full setup has to be there. And if, last but not the least, if someone is inviting you from some countries, if you have any brother sister, then the chances are even more higher. All right. So, like, of getting the visa and the things, actually. All right. So hope this particular thing helps. Last but not the least, there's a summary thing, as you all can see. This one I think will make a separate video, compare contrast. But some people, you know uh, get offended, because they are working in this country and they say, no, we are good. See, when you come out from Asian countries and things, in these countries, people feel better. I mean, it's sometimes psychological, actually. And everyone wants to say, oh, okay, I'm the best, my, where I'm working, it is best, it is like that. Not everyone has experience, like, going to different countries or working in a different field. People always don't work with so many number of doctors of different countries as like we do. So we thought of giving a view, that's idea. But do understand, these are a lot of things are my personal view. So anyone, please, if you see this video, don't get offended. But rather, if you have an inquiry in a constructive way, you can ask in the comment section. Definitely, I'll be answering you back in 1 to 2 days. Definitely, usually in 24 hours I answer everything. All right. So all the things we have discussed: costing, salary, job, yeah, so all this thing, quality of life, visa rejection things, then popular exam, fast job takes time, entry to the training, then working hours, yeah, so validity. By the way, guys, every of this country, whatever you will get, there will be taxation. There will be taxation, actually. So example, in UK, they roughly earn about 2,500 pound to up to 2,800 pound in the beginning, whereas an Australian doctor earns like approximately 7,000 to 8,000 Australian dollar in the beginning. So you can see the margin is a bit higher in Australia, actually. Australian dollar, we mean to say 7 to 8,000 Australian dollar. Whereas in USA, they usually also start earning in the similar, like around, like Australia, it's like 5,000, 6,000 Australian dollar, which comes around similar like in Australian dollar. So you should know the conversion rate. Don't get confused with the terms I'm using right now, actually. All right. So I hope so. Some certain these things are useful, and there's some forums. I put some free materials like PLAB 1 and 2 guideline. They have a file section. You can download free files. Share your AMC guideline is a big group, so you can also go and see the file section for free files. And for USMLE, there are also Share your USMLE forum. You can see for the free files, actually. All right. So I hope so this video is useful for any of you. Please like, share, support us, help us getting more subscribers as like other YouTubers do. I will try to make more useful videos like this. If I miss any point, do let me know. If I miss any other good point, because a lot of things are common in these all three countries: good food, good education for kids. So these are technically quite good in lot of these countries actually. So one point maybe I missed, education for children is almost great in all these countries. So almost great is all these countries. So these are the certain things I think this will help you, taking the decision in future. Please comment in the YouTube, but I'll be also dropping my WhatsApp. But make sure, unless very specific inquiries, or you really got stuck, please watch some of the other videos first, and then WhatsApp us in that case actually. Or you can also WhatsApp us for courses, or if you are in decision of going to which country, then you can WhatsApp us probably in that case actually. We'll try our best actually. Thank you so much for watching. This is Dr. Shahriar Ahmed Shuja. You can also follow me in social media as Shahriar Ahmed Shuja in Instagram and Facebook. You will find me as well. Thank you so much. Have a lovely day. Good night.